Victoria has ruled out a second safe drug injecting room against the advice of a long-awaited report. Georgia Simpson is live for us today in Melbourne. Georgia, the Premier says she couldn't find a suitable location.
Yeah, Kieran, that's right. That's the crux of it. Basically, the state government today in Victoria rejecting recommendations from former top cop Ken Lay's report of introducing a second safe injecting room into Melbourne's CBD. Instead, the state government will be introducing a statewide action plan worth about $95 million. This was announced today, almost 12 months after Ken Lay delivered his 100-plus page report. This report is quite comprehensive, but it really highlighted the increase of heroin usage and deaths around Melbourne CBD, and that the City of Melbourne has the highest rate of drug use across the state. This report, though, also acknowledged the challenges in trying to find a suitable location for such a service, trying to strike a balance between finding the right location for people to be actually be able to use the service versus the broader expectations of those who use the CBD. And this is what Premier Jacinta Allan said it turned out to be a major barrier in the government setting up a second safe injecting room, and one of the main reasons why they won't be proceeding.
An injecting service trial has less chance of success without the legitimate needs of the community being recognised and addressed. And this issue of the location has been a key sticking point. We have been unable to find a location that strikes the right balance.
This statewide action plan announced today includes 11 actions, I guess you could call it, worth $95 million. As I mentioned, I'll take you through some of the main ones. There's $36 million for a new community service health hub to be located in Melbourne CBD at 244 Flinders Street. The Mental Health Minister Ingrid Stick confirmed that works are already underway and it should be ready by 2026. There's $9.4 million for a wraparound health and support services at this health hub. There's $21 million towards increased outreach services. This will boost co-health's presence and support across the CBD, but will also expand to 2 other locations in Melbourne. And there's $7.2 million for hydromorphine treatment. This is a Victorian first, and there'll be enough for 60 people with severe heroin addictions to trial the medicinal approach over 2 years. Now, there's been plenty of reaction to the government's announcement today. The Greens, perhaps the most scathing. They've said it's a spineless captain's call that will cost lives. As for those key stakeholders involved in this report and involved in supporting people with addiction issues across Melbourne CBD, their response was mixed. There's, of course, disappointment that the second safe injecting room won't be proceeding, but there's also, I guess, a positive and a sort of bolstered attitude towards the extra support services that the government will be providing right across the state.
We do have mixed emotions today about no injecting room in the CBD, but we are deeply encouraged by the Allan government's commitments around a number of levels.
There's mixed emotions in relation to this, and some of the questions have been clear that there's evidence that injecting rooms save lives. We'll continue to advocate because we're advocating for evidence-based solutions.
In response to if the state government will be ruling out safe injecting rooms more broadly across the state, the Premier Jacinta Allan confirmed yes, this draws a line in the sand for any more safe injecting rooms across Victoria. The one in North Richmond will remain, and in fact that will have some extra support services attached to it. Kieran.